I am Dr. Mohnish Grover, working as professor in the Department of ENT, SMS Medical College, Jaipur. Did my post-graduation from AIMS, New Delhi, and then senior residency from PGI, Chandigarh. And it's been a privilege to work in all these three institutes. The best part has been to learn various techniques of otology and rhinology surgeries from all these three places. And that's where the experience of using the various types of instruments and equipments comes into place. As far as my personal experience is there, my field of interest is basically in implants, that's cochlear implants, doing various kind of otologic procedure like trapedotomies and endoscopic sinus and skull-based surgeries. If you consider the number of implants, I've done approximately 500 cochlear implants and a lot many ear surgeries, which would also include basic surgery, tympanoplasty and mastoidectomies. And endoscopic sinus surgeries would include basic FES, CSF rhinorias and various skull-based surgery, pituitaries and anterior skull-based tumors. I also do a few of thyroids and parathyroids, which are a fascinating field in the ENT gambit nowadays. ZEISS has been a part of majority of these surgeries because of the sheer optics and the backup support which they provide. Whenever you land up doing a surgery which involves any kind of good optics, ZEISS is probably the first name which comes into our minds. And that's not something surprising because we all have been brought up being taught on instruments, on equipments like microscopes which have been made by ZEISS. And that is not surprising again because the backup support whenever you have any issues with such microscopes has been wonderful, and we have been very happy to have ZEISS people around to help us out with any such issues. Coming specially to ZEISS EXTARO 300, it has been a real great advantage simply because the optics have been wonderful. The various modes which it provides are awesome. I have personally been very happy using the multispectral mode, which when I'm doing cochlear implants, it helps me to judge the depth very well. If there is any ossification or fibrosis in the cochlea, I can really judge it comparatively much better using the multispectral bone than the routine mode. Same goes with the stapes surgery to look at the thickness of the stapes footplate. The second mode which I love using is the no glare mode. That is effective especially when the electrodes are being inserted, so that the glare which comes off from the electrode by reflection is very limited in the no glare mode. You can have a look at the opening in the cochlea, the round window, the surrounding structures as well as the electrode array. Otherwise, what used to happen earlier was that one or the other thing would be missed out. Either I would be seeing the electrodes or I would be seeing the surrounding anatomy. But now no glare mode helps us out. This is similar for stapes surgeries or using any other prosthesis in the middle ear surgery. So that's where the no glare mode is something which helps me out. The third thing which really fascinates me about EXTARO 300 is single-handed use. The technical part of the single-handed use helps me because if I'm inserting an electrode array or putting a prosthesis in, I can just do it with one hand, stabilize it, and with the other hand I can change the settings of the microscope. So that helps me to not to really leave the process of the implant completely using both my hands on the microscope. That makes my life much more easier. Obviously it goes without saying the optics, the apochromatic, the illuminations which you get, the spherical aberration which is taken care of, which has been a part of ZEISS in other models. As we graduated from ZEISS Pico to EXTARO, these things have always added a lot of new things to these things. The basic things that again comes as is because it's an academic institute where teaching is an integral part, the recording of the videos becomes important. The digital app which ZEISS EXTARO 300 has makes it very easy for us to record these surgical videos, to transfer them to various devices which we have from various surgeons which are there in the department. We have a big department of 15 faculty members. So this easy transfer of a recorded video in a very high quality is of utmost importance when we have to teach our residents. So overall, if I were to rate ZEISS EXTARO 300, it's like on the top of the notch technology for us, which has helped us to gain a lot ourselves as well as for our patients and for teaching purpose.